I speak for a living. It's a big part of what I do, whether I'm entertaining clients or I'm speaking on stage or internally. And over the years, I had ground my teeth into this wave. And so over time, I became more and more self-conscious. I stopped smiling. When I entertained, I found ways to talk where I didn't have to show my teeth. And it held me back.
When we first saw Andrew, he was a very, very severe dental wear case, a lot of attrition. And when you look at his pre-op photographs, you can actually see the wear pattern of his teeth, where if you looked at the plane of his teeth, it was like a roller coaster. That wear was further accentuated by the fact that, especially his front tooth, which had a root canal and had crown on it, caused a lot more wear of the opposing tooth, and the tooth in and of itself was fractured.
So after talking with the doctor, we decided to remove 2 teeth, put an implant in, and fill the other 12 spaces with crowns, and reconstruct my entire smile through that. So I remember the moment when the last of the crowns went on, and the mirror was handed to me. And when I saw myself in the mirror, I felt like a different person. I felt like I no longer had to be self-conscious. Where I am right now, I'm incredibly thankful to Dr. Beckwith, to his team. The care I got along the way, both pre, during, and post, makes me feel like I have nothing to worry about. This is gonna be my smile for the rest of my life. I have every comfort that my smile's here to stay, and I just feel well taken care of here.